Well, every Thursday this month, News 18 This Morning is teaming up with IU Health Arnett for Breast Cancer Awareness Month. A breast cancer diagnosis, it's a time when support from friends and family is obviously crucial. But there's another source of support available right here in our community. Breast cancer navigators like Deidre Smith can guide patients through their breast cancer journey and help make it a little easier on them at such a critical time in their life. Thank you so much, Deidre, for joining us this morning. Let's start off by talking a little bit about what is a patient navigator and what do you do for the patients?
A patient navigator is someone who can guide them. I meet them in the very beginning when we give them their diagnosis after they've had their breast biopsy, and then I schedule their appointments and actually go with them to all of their appointments. We have a team that treats this patient, and so I follow the team. We have the radiation oncologist, the medical oncologist, the surgeons, the plastic surgeons, and so I work with all of them and follow the patient through all of those appointments to guide them with their decisions and further explain and give it more detail what the plan will be.
So really you are almost their go-to person for emotional support, moral support, the logistic side of things, and you were saying too that family members could take advantage of it.
Exactly. So when you have many physicians involved in your treatment plan, sometimes it's intimidating to ask them questions. And so I have them call me, and I'm a one-on-one contact. And also I can answer questions from any of the team members. And if I don't know the answer, I can contact them to get their answer. Family members often call me with the patient's permission, of course, to further explain what is going to happen or what they might need to expect.
And so if we have patients out there this morning that might be going through their own journey and haven't taken advantage of the patient navigator, they must be through the IU Arnett system, but how do they go about getting signed up to take advantage of the...
Well, our goal is to connect with them in the very beginning, but if there's anyone who might come in later in the process, maybe had a treatment somewhere else, if they call the cancer center and ask for the patient navigator, they can be transferred to me and I can contact them. So anyone who receives any type of treatment at IU Health Arnett is entitled to have a patient navigator. And I focus primarily on breast cancer, and we have another navigator who focuses on GI cancers, and we will soon be adding lung. So if they just call our cancer center or call the 800 number to IU, they can be transferred.
Okay, Deidre Smith, thank you so much for joining us. We'll of course have all that information on our website, WLFI.com. We'll be back after a short break.